failure, and this is going to be a pretty straightforward video lecture. So the child with respiratory failure, respiratory failure is defined as the inability of the respiratory system to maintain adequate oxygenation of the blood with or without carbon dioxide retention. So the child has increased work of breathing, hypoxemia, acidosis, may have complete cessation of respiration, and that would be the respiratory arrest. Apnea is defined as a cessation of breathing for more than 20 seconds. But in the end, so what are the clinical manifestations of respiratory failure? Pretty much not breathing, or apnea, or hypoxia. So anything that can be obstructive or mixed, central airflow absent, or obstructive. So how do we diagnose? Well, it's a presence or history of a condition that might predispose the patient to respiratory failure. Observation of respiratory failure is a diagnosis, and management of or measurement of the ABGs. Therapeutic management, so interventions are emergent. They are resuscitative measures, opening airway positioning, administering supplemental oxygen, and CPR. When the situation is not an arrest, the suspicion of respiratory failure is confirmed by assessment. And so you either have, or if it's arrest, then you're doing CPR. If it is not an arrest, then you're monitoring through ABGs and maybe doing CPAPs or early intubation. Nursing management, so anyone who is CPR certified, any babysitter is encouraged to be CPR certified for any respiratory management. Choking is something different. That would be aspiration, and with the choking, you are also following CPR protocol. After Heimlich is not, the Heimlich maneuver has not achieved desired results. Okay. Principles of respiratory failure management: maintain ventilation and maximize oxygen. You're correcting hypoxemia and hypercapnia. You're minimizing organ failure. Provide specific therapy to control oxygen demands, and you're anticipating complications. CPR, the following slides are some of the standards of care and your etiology of cardiac arrest. So you just look through these slides. Of course, the etiology varies with age, underlying chronic medical condition, trauma, near drowning, severe asthma attacks, anything that respiratory failure could lead to, or respiratory distress. So your standards of care are CPR or pediatric ALS, which is advanced life support. The following two show the mouth-to-mouth nose breathing for an infant, and then any recovery position. But just review your CPR guidelines for this episode.